Hi, my name's Rahi Talekter, and I will be presenting on friendship as love misinterpretation from a neurodiversity perspective. So this is kind of the agenda. There's like 15 slides or so. I know like 7 to 10 minutes, so I'll kind of just brush upon the few topic bullet points or so per each slide. So I'll be talking about neurodiverse conditions, and while it is an entire umbrella for a lot of different conditions, I'll really be focusing more on ADHD and autism. So reviewing what the DSM-5 had said about both for ADHD, there is the variety of focus, whether hyperfocus or inability to do so. But then also challenges with emotional regulation. It says craving reassurance, which when we talk about attachment styles, that seems super similar to anxious attachment style. Novelty seeking. And then for autism, it's really more known for the social context and differences in that aspect. Some may say deficits. Also having fixated or restricted interest in certain behavior styles, hypo or hypersensitivity. So I have a few words bolded of like hyperfocus and fixated interest. So these can be for like hobbies or such, but then it could also apply for people and like a love interest or even a friend interest. Sorry about that. So dating restrictions in non-Western cultures, like for South Asian, I've heard a lot of times of you can't date until you're married. So after taking this class, I can definitely see how it can lead to certain like stilted developmental growth in a way. For external individual, the it, anything biological such as brain scans, fMRI, that can be used to diagnose at least autism. It can't happen for every other condition like ADHD, but you know, it can help for a few. And then for the its area, how the environment may impact a population, a high stress transition, and also what can lead to the equifinality versus multifinality, and you know, how many protective factors are there for that individual. I also put, you know, attachment theory here, other cultures, a family structure, that can be seen and kind of assessed in that objective manner. Okay, hopefully this works. So now we can look of the lens through neurodiversity with attachment theory. So Mary Main, she is actually credited with having created the disorganized attachment category. And in one study, she had led 19 autistic children. There was a main classification of a disorganized attachment for 15 of them, that they had the push-pull dynamic. Now with that being relatively new to look into a subcategory, less than half of them were secure, 7% avoidant, 13% attached. And because of how avoidant attachment can lead to withdrawal, similar traits such as autism of like social withdrawal, you would assume that there would probably be more avoidant tendencies, but that's actually not the case. It seems to be like 7 to 15% tend to be avoidant. Plus, what we had mentioned similarly of ADHD people, they may seek constant reassurance. That is something similar to anxious attachment. And to look at attachment theory, there's usually like high rates of avoidant coupling with an anxious. Not the best dynamic, but that is something of looking to satisfy a need from each other or so. However, overall from these studies, it's that neurodiverse kids do seem to have a higher rate of a disorganized attachment style compared to neurotypical kids. So, unicorn among the zebras. So now that we see how, the neurodiverse can kind of compare among the whole, now to look into the emotional aspect. They can have intense emotional experiences. It's like the bandwidth of their emotional spectrum is so much more, right? We may think about everyone's just kind of at this range, but it is heightened. It's so much more. The highs are super high, the lows are super low. It can also lead to impulsivity or limerence, obsession, emotional dependency, and if you were to think of these conditions of ADHD, autism, people with these conditions, they have higher increase for isolation, being bullied, wanting to escape where they're at, their environment, and so they may fantasize more. One study showed that 17% autistic individuals actually unfortunately meet criteria for PTSD. They're wanting to seek acceptance, right, in a place where they may not find so much acceptance. So now when they're within like people, in these studies that showed autistic to autistic communication, and it's actually shown that it's harmonious, it has higher rapport as compared to like neurodiverse to neurotypical is actually less rapport, and that neurodiverse people talking amongst kind of their own people in a way, it does lead to a higher quality of life. And that makes sense because, maybe it's something they rarely find someone who they mesh well with. And so to find like that rare person out of a few hundred or even 1,000 seems like they came across a unicorn, right? Someone similar to them or someone who finally understands them, that acceptance. Now, I do want to point out that there can be some risk to injury because of these heightened sensations and emotions. There can be the risk of erotomania, of believing someone's in love with you, of stalking. We're talking about like fixated interest, of wanting to learn everything we can about it, or the hyper focus for it. The obsession, love bombing, rumination, these all can just be increased. Anyone can do it, but it seems that it could be increased with these population of folks. Psychosis, rejection, sensitivity, dysphoria, anything that could lead to, the 4 Ds of psychopathy, cross boundaries, trauma, anything being comorbid, and we talked about the PTSD criteria, but then also another study showed of, unfortunately, a lot of women first get misdiagnosed as borderline personality disorder, or it may be comorbid before or while getting their autism diagnosis. And that is why receiving a correct diagnosis is so important in being able to understand their perception and kind of everyone's perception and how different it can be. That it's not necessarily apples to apples, but it is apples to oranges, and noting it as such. And so here are some ways to manage the emotional intensity to help with a relationship. And so for the neurodivergent population, it can be DBT skills, dialectical behavior therapy, especially focusing on distress tolerance, emotional regulation, couples therapy. In our textbook, it did say for developmental disorders that serotonin helps. Practicing naming emotions, getting more experience or social skills, and managing the expectations and knowing that they do have heightened emotions compared to most people. And then for a neurotypical population, there's a study showing that Once neurotypical folks learned a lot more about autism and could communicate better with neurodiverse and autistic individuals, there was better communication. And so it does certainly help. And remarks, I think it just kind of goes to show that this is why the diagnoses are really important. Whether it's shared or not, but to also understand that not everyone has the same emotional bandwidth or sensitivity, and also clarifying what relationships are like for a neurodivergent individual, for someone who may have such rare, few close relationships to begin with. So an example is like maybe there's a neurodiverse and neurotypical couple, and the spouse is neurotypical. Main neurodiverse person found a friend at work who's also neurodiverse. And they can have that strong friendship in a way, but it's also needing to understand where the boundaries are, that everyone's with respect to each other's relationships, and that misunderstandings or discomfort, relationship issues, hopefully can all decrease, but being able to know exactly like what is what and not crossing any lines. And maybe it's differentiating like where romantic love is and platonic love. Conclusions, what did I learn about this? I thought developmental disorder really was more just biological. I didn't know how much environment was at play for it. This was my first time using Cameo, so also I hope all these different videos where I fumbled around a bit, it worked out well. Grateful for Dr. Collins for helping me with the BPSC map and reviewing attachment theory. But also coming across all these different research studies, it really did help enforce what my experience was, but then also be able to give me that infrastructure and kind of the words to being able to describe it. And more work can definitely be done in making sure more folks are aware of what the differences are when it comes to neurodiverse emotions and sensitivities and strengths, and where future research can lead to. A lot of different ways. There wasn't an exact study of what I was looking for, so maybe something between, the blurred friendship relationship line, or if there's awkwardness. At what rate does a neurodiverse or neurotypical look at online content regarding their crush or special interest? Looking at it through a lens in so many different ways of mixed couples, same couples, reviewing emotional intensity, and also like over time how hormones may affect any of these conditions, because I know more research is always needed that way. And here are my references, and thank you all very much.